Have you ever gone to your GP with vaginal dryness, recurrent urinary tract infections, painful sex, for instance, and been told, oh, it's just a normal part of aging? And it's really exciting because recently there are new guidelines that have been published by the American Urological Association, and they are the first ever guidelines on something called the Genitourinary Syndrome of Menopause, and they are about to change everything. And I'm also going to address the skepticism that some of us might be feeling around there, and also link some important articles at the bottom of this. So welcome to my channel. My name's Kate. I share a weekly video with you every Monday around something related to menopause, and today we're going to dive into genitourinary health and also news that we can actually take a lot of support from, whether you take HRT, choose not to take HRT, are unable to take HRT due to blood clot risks, breast cancer risk, etc. And I'll be diving into all of that in today's video. Genitourinary Syndrome for Menopause is shortened to GSM for ease of saying. Basically covers things like vulvar discomfort, dryness, recurrent UTIs, painful sex, low libido, muted orgasm, and that kind of thing. And you may be of the opinion that you don't want to take HRT. I have never taken HRT myself. And I also work with a lot of ladies who are not able to because of that breast cancer risk, or the increased blood clot risk, etc. And the new guidelines really are pointing to the fact that you can take these topical estrogen creams and gels and suppositories, etc., which I'll go into in a bit more detail in a few minutes, safely without increasing your risks of developing the clots, the cancers, etc. And it's not just a little dryness. We're talking about a progressive chronic condition which tends not to improve as you go through into postmenopause. A lot of the perimenopausal, menopausal symptoms actually do improve as you get beyond postmenopause. But things are related to your genitourinary health tend not to. So if you're getting those recurrent UTIs, if you do have that extreme dryness, then this is something that you probably want to explore in more detail. The 2025 breakthrough guidelines are evidence-based. They're very clear. They were put together by a wide range of different people in the health sphere. And they concluded that vaginal estrogen, topical estrogen treatment is safe, that it's effective, that it's lifelong, a bit like brushing your teeth, you just do it forever. It's very flexible, so there's not just one specific treatment. So it's about offering women a toolbox, and also, most importantly, in consultation with women. I think often a lot of the time women are gaslit around menopause. It's not that serious, go away, this is just a normal part of life. This is very much an inclusive conversation, or that's what the recommendations are. There's a much more inclusive conversation with you as the woman seeking the advice, and where it's not just one thing that you might be offered. These are your symptoms, these are how we can actually deal with it, and this is what we would together between us decide might be a protocol for you to follow. It also acknowledges androgen therapy, which is vaginal DHEA. DHEA comes from our adrenal glands. It's a precursor for estrogen and testosterone. It's not a topical estrogen gel, but the vaginal DHEA can also be something that can make significant improvement if you are struggling with genitourinary conditions. And why does this matter? It matters because around only about 4% of women are currently using topical vaginal therapy. So that means that they're not necessarily taking HRT. You can use it in conjunction with HRT as well. But for the women who literally are struggling with these genitourinary problems and they are not taking the topical vaginal therapy treatments, only 4% of the population are currently using that. And when you think about the vast amount of women who are suffering with these various issues and often don't want to bring it up because they think it's embarrassing, particularly if you have a male doctor and you don't necessarily want to talk to him about your vaginal dryness, or the fact that you're not feeling sexy anymore, or you're struggling with your libido, or you have muted orgasms. That's not necessarily a topic that you find easy to talk to your doctor about. So these new guidelines are really going to help you. And in actual fact, I have linked the website where you can actually get to these guidelines and print them off. So if you find talking to your doctor about these things a little bit embarrassing, you can show them the guidelines, say, look, are you aware of these? If you're not, please take a read through, because maybe paragraph 1 point whatever it is what I would really like some help with. And so it gives you a sort of a roundabout way of addressing issues that you might find embarrassing to talk about, and actually getting appropriate treatment for. And for the 4% of women who are taking vaginal hormone therapy, there is a 22% risk reduction in hospitalisation, there's a 51% reduction in sepsis, and there's a 73% reduction in mortality. And you might think, what, 51% reduction in sepsis? How could you develop sepsis from a urinary tract infection? So often it will start as a normal, cystitis. And then left untreated, if your body is not able to either manage it itself, which in often cases it can, but if it does not, and you might have antibiotics that are not necessarily working effectively, then that can travel up the urethra and then it can infect the kidneys. The kidneys then become infected. You feel really poorly with it. I've had a kidney infection twice from cystitis. I felt absolutely awful. And I'm glad I didn't know in those days that it could develop into sepsis. Eventually, the treatment that I was on managed to overcome it, but I was really poorly for a couple of weeks with it. So if for instance, you leave it untreated, or the antibiotics that you're being given are not working effectively, that can then eventually lead to urosepsis, which can then be fatal. The menopausal women are more prone to developing sepsis because we've got thinner vaginal walls, our urethra wall is thinner. The vaginal pH tends to change, so it might become a little bit more alkaline as we go through the menopause, whereas it should be slightly acidic to keep that healthy natural microbiome level in the vagina correct. There might be incomplete bladder emptying due to pelvic floor dysfunction or possibly prolapse. We tend to have a bit of a blunted immune response as we get older. And also, there are more procedures that happen to us as we get older, and if a catheter has been used in hospital, that can also increase the chances of bacteria entering the urethra and then obviously going up into the kidneys and possibly leading to urosepsis. So it's just something to be mindful of. I'm not showing that to make you think, oh my God, I've got cystitis, I'm going to die. It's not like that at all, but don't sit on it, and make sure that you're getting effective treatment and that you're starting to feel better quite soon after you take whatever treatment you've been advised to take. And the 73% reduction in mortality obviously ties into the 51% reduction in sepsis, because obviously some cases of sepsis, they're curable, and other cases it will be maybe found too late, it will be treated ineffectively, and sepsis then will lead to multiple organ failure, and that is where that 73% reduction in mortality from a UTI is taken from. And the paper presented that if every woman who is menopausal, perimenopausal, had access or took vaginal hormone therapy, it would save Medicare somewhere between $6 and $22 billion. I will come on to the UK in a minute because I know a lot of my viewers are based in the UK as well. And also, let's just talk quickly about hip replacement surgery and UTIs and why there seems to be this comorbidity. So if you're at a much greater risk to develop a UTI after you've had hip surgery, and that's partly because you've got the invasive surgical procedure taking place in the hip, and of course your genitourinary organs are a lot closer. The blood vessels, the capillaries, they all interlink a lot, and if you've got an infection that develops in the hip, that can be much more easily transmitted around to the genitourinary organs. But also because of catheter use, it could be also that you get the bacteria into your urethra because of that catheter use, which can then spread from the genitourinary organs back to the hip. So you have this sort of comorbidity risk, increased risk when you have hip replacement surgery because of the use of the catheter, because of the hip surgery, because of the swelling and the inflammation in that area. Also, after that sort of surgery, the bladder may not empty itself fully, and so then you're at a greater risk of a bacterial infection developing within the bladder itself. And so it might be something that, for hip replacement surgery, it might well be worth just mentioning this to your surgical team or your doctor if you're not already taking vaginal hormone therapy, to consider that, let that be part of that conversation if you're scheduled for a hip replacement surgery. Any catheter use is going to increase the risk of a UTI, particularly perimenopausal and postmenopausal, because of the fact, the bacteria changes down there. Tissues can become thinner, they can become drier, and so you're more prone to infections. But because of the proximity of the hip to your genitourinary organs. That is the main issue around the hip replacement surgery. And in some cases, if you've had a UTI or develop a UTI and you've got your hip replacement surgery that's still healing, it can lead to something called prosthetic joint infection. And in severe cases, it might be that you have to have the recently implanted new hip removed, that area cleaned out, and then another hip put back in again. So it's the complications there are real. And after hip replacement surgery, the mortality rates after hip surgery are huge as well. So in the first instance, look after your joints. But in that case, make sure that you are having a wide-ranging conversation with your doctor, and do consider these other aspects that are going to increase your chances of having a really successful recovery. And that also includes, making sure that your gut health is good, because a lot of your immune system is in your gut. And if your immune system's good, then the chances are, for any small infections that may occur, you might be able to fight that naturally as well. And it's highly likely you're going to be on a course of antibiotics after your surgery. So if that is the case, make sure that you're also taking some appropriate multidofilus or healthy probiotics to help repopulate the gut with the healthy bacteria, which are going to be pretty much eradicated while you're taking your antibiotics. So it is a multi-pronged approach, but if you're aware of that, these are things you can bring up with your doctor. Your doctor might poo-poo them. Your doctor may not even be aware of them. But a healthy functioning gut microbiome is going to serve you so well. A healthy vaginal microbiome is going to support your health too. So if hip surgery is on the horizon, consider these things, have a chat with your GP, your healthcare provider about them, and just make sure that you're going into that surgery knowing the risks, but also understanding the ways that you can mitigate a lot of the potential risks that you might be opening yourself up to. And also remember, once you have a new hip, it can give you a brand new lease of life. So I'm not anti-joints at all. I think I might need to book in for 2 new knees at some point. I'd much rather have them done sooner rather than later. But again, if I ever have that surgery, I will be considering all these things myself, so that I can mitigate the risks of any long-term damage caused by the antibiotics, to make sure my new joints settle in really, really well, and also get really, really strong before I have those surgeries, to make sure that my body can support the new joints as best as possible if I actually have to go down that route. So it is a very real thing, but this is not to sort of make you worry about all the things that might go wrong. I think it's really important that hundreds and thousands, millions of joints are replaced yearly, and people recover from them very, very well. But also just be mindful that you can increase your chances of a speedy recovery by becoming aware of your vaginal microbiome and your gut microbiome to support your recovery, and make sure that you are not one of those statistics that don't come out of hospital. Just want to talk a little bit more about the vaginal microbiome. It's lactobacillus, which is the healthy bacteria that helps to keep the acidity levels correct in the vagina. And as we go through perimenopause and beyond into postmenopause, we do tend to have a falling acidity level, which in and of itself isn't serious. And if you're not getting any issues, I wouldn't worry about it. I have never had vaginal hormone therapy myself. I've been postmenopause, oh gosh, for probably over 12 years now. No problems really. But I would be mindful of that. I just wanted to bring it to your attention, because you're probably thinking, lactobacillus, that's like fermented foods and sauerkraut and things like that. So eating things like sauerkraut is not going to have a direct impact on your vaginal microbiome, but it will significantly improve your gut microbiome. 70% of your immune system resides in the gut. So a healthy gut microbiome is going to support a healthy vaginal microbiome. So just be mindful of that. If you're thinking, oh, lactobacillus, sauerkraut, it's the same healthy bacteria, but eating more sauerkraut isn't necessarily going to impact your vagina directly, but it will do indirectly by supporting a healthy gut microbiome. And all the systems of the body are interrelated. So if you've got a healthy gut, you've got a healthy immune system. It also supports your mental health. And if you've got genitourinary issues, I think they're one of the worst things to have. I know when I've had that cystitis, and it just makes you feel vile. It's horrible. It just makes you feel really undermined. I don't know why. It's just one of those things. It's very sensitive. It's horrid. And if you've got strong mental health, it'll help you have that resilience around those infections if and when you get them. So if you're watching from the UK or somewhere else in Europe, you might be thinking, yeah, but these are all sort of American guidelines. Will they really make a difference to us here? And actually, yes, they will. They are incredibly impactful. GSM, Genitourinary Syndrome of Menopause, exists everywhere. 50% of the population has a vulva and a vagina. And it's really important that we get less embarrassed around mentioning those words. And the evidence to support maintaining a healthy vagina and healthy genitourinary system affects all of us. It's really important that we're all aware of this and that we're having these conversations and that these actual guidelines have been put out. I'm going to address the skepticism in a minute. In the UK, you may need prescription access for these treatments, and that might require some specialist initiation, but your GP should be able to advise you on that correctly. Product names and availability that are mentioned in the American report might be different to what we have over here. But again, your healthcare provider should be able to think, okay, well, that's an American name. The UK equivalent is, or the European equivalent is, and I wouldn't get yourself bogged down too much in that. If you're somebody who loves to research things like I do, it might be you could say, what is the UK equivalent of da 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 da, what the American name is, and then at least you can take that to your healthcare provider. We're in a strange situation at the moment because doctors in their general practice and their general studies, while they get taught some incredible things, they are still not taught very much about menopause at all, and they're still not taught very much about nutrition at all. And those two things tie in hugely to midlife woman's experience of life, anywhere really from the ages of 30 and upwards. I think things will be changing on that front, but right now, unless a GP actively goes and trains herself in menopause and nutrition, because nutrition is such an important part of what we experience in the menopause, we also have to advocate for our own health. So it does mean getting onto Google, doing a little bit of research, printing off those guidelines, taking them to your healthcare provider. Probably be doing him or her such a favor too, because they may not even have seen those guidelines. They've not long been released. So, if you've got an appointment ready, print them off, have a read of them yourself, and take them to your practitioner. And you might find that they're actually learning stuff at the same time as you are, because like I say, they may not have actually been made aware of those guidelines yet. And if you're thinking, oh yeah, that all sounds great, but I know I'm skeptical about a lot of things that are put out there these days. And, after COVID, and I think there's a lot of distrust around the medical world. And while I think doctors and surgeons do incredible things, you also hear so many stories of people that have not been treated properly and as a result have had life-changing problems or indeed have died. And I think it's right to be skeptical. I think it's really important that you weigh up the pros and the cons of all these things yourself as well, because let's face it, we're in a world of information now. And also, let's face it, the bias that you're looking for, you will find it to support you. So for instance, if you are thinking, is cow's milk good for you? You'll find an entire camp of publications that say it's the best thing you could ever drink. If you type in, is cow's milk bad for you? You'll find an entire other camp that suggests otherwise. So you do have to do your research, and you have to be open to looking at both sets of research, and also be really mindful about who has written those articles, because if it's the dairy board, you might be a little bit more skeptical. But I think it's down to us all to do a bit of due diligence, just so that we know we're not going in there completely blind and blinkered, and we maybe have an opinion where we could possibly ask a few more probing questions if you feel you need to. It's your health, it's your life. So get on board with that agency, your self-agency, and inform yourself as much as you can before you then go to the doctor for support, because you'll have a much deeper conversation if he or she knows that you're aware of this, that, and the other. is going to be a different conversation than, and they may actually give you a bit more time as well, because there's, oh, she's done her research. And if it's just like, what are you talking about? This is a load of rubbish. Stop worrying. You're absolutely fine. Go on your merry way, which I've heard so many reports of. Go and find another doctor, or challenge that doctor, or write to the head of your doctor's, you know, the head of the board that represents your healthcare institution. Make sure you are getting the care that you feel you deserve and that you need, and that you feel happy that the various questions that you have been answered sufficiently. They are there to serve you. You're not there to make their life really, really hard on purpose, but ultimately they are there to serve you. So make sure that you feel informed and that you feel comfortable that the advice that you've been given is what you're happy to accept receiving. Low dose vaginal estrogen is not the same as systemic hormone replacement therapy. They are entirely different. The body will always absorb some of what you're putting on it or in it because of the blood flow. The little capillaries will absorb some of it, but apparently the amounts are so low that they're not going to have a detrimental impact on you, even if you are high risk of breast cancer or the clots, etc. And there's also a review that I've posted below from the Journal of American Medical Association that found no increased risk of breast cancer for women using vaginal hormone therapy after breast cancer. The North American Menopause Society and Menopause Society UK both support its use with shared decision making in women with a history of hormone sensitive cancer. Similarly, blood clot risk is associated with systemic hormone replacement therapy, but not topical estrogen related vaginal hormone therapy. So always ask, does your family history increase your risk of developing various problems? Can your GP or your specialist refer you to a menopause clinic for shared decision making? And is there a non-hormonal option that might be safer for you? So just moving on to practical solutions. So these guidelines really offer you a whole toolbox of various things available to you. There are vaginal creams that you can rub into the vagina. There are pessaries that you can use. There's a ring that you can insert, and I believe that stays in place for 3 months. There are tiny tablets that you can insert into the vagina. I think that's twice a week. There's DHEA suppositories, which are a gentle form of androgen therapy. And there's an oral non-estrogen option too that you can take like an oral pill. There's also an incidence of women who start to take the vaginal hormone therapy that you might have an increased risk of a yeast infection. And the general advice on that is just to keep taking what you're taking. So it might be that you back off it a little. The reason for the yeast infection is it's the acidic environment of the vagina coming back up to where it needs to be. So I mentioned earlier, as we go through perimenopause and menopause, the vaginal pH can change slightly. So it can become slightly more alkaline. When we start using hormone vaginal therapy, it makes it slightly more acidic again, which is where it ideally needs to be. So while that process is occurring, it might be that you're a little bit susceptible to yeast infections. And again, you don't have to chat with your healthcare provider about that. But all the stuff that I have seen online is just like, keep taking your therapy. It will eventually get better when the vaginal microbiome gets to where it needs to be. But also, you know, some of them are recommending maybe you sort of back off it a little bit. So you still use it, but maybe not quite as much. So you allow things to sort of change in a more gradual way. And eventually you will find that the vaginal microbiome will balance out and you will no longer have those yeast infections. So really these guidelines are not just about intimacy or comfort. They're reducing your antibiotic use, because if you're not getting UTIs, you don't need those antibiotics. And those antibiotics, like I mentioned earlier, nuke your microbiome in your gut. If you're taking antibiotics, make sure you're taking a wide range of healthy probiotics to repopulate the gut microbiome. It helps to reduce hospitalisation. It supports women's mental health because genitourinary infections really do knock you sideways. And it also gives women clarity and more confidence around their genitourinary health. So what can you do now? You can visit the AUA's website, link is below, so that you can print out those guidelines and take them to your healthcare provider. I would definitely encourage you to read them yourself too and become informed so that you have a greater awareness of them. And just know that you have options. Taking a flexible approach takes a lot of the stress out of this. So, you know, you can always start one of the various options and see how you get on with it. If it doesn't suit you, know that there are more options to choose from. If it does suit you, well, then you can continue with it. But having that sort of open communication with your healthcare provider is going to give you confidence, it's going to give you clarity, it'll make you feel supported. And I think when you feel like you're getting the good treatment, it has a profound impact on your mental health and also just how you show up in life. And if this opened your eyes, I highly recommend you watch this next video, which I will also link below, which is around menopause, testosterone, and belly fat. Because when you are stressed more, worried about things, your cortisol levels rise. And cortisol level is one of the main reasons you might be struggling with belly fat. I will link the video below, Menopause, Testosterone and Belly Fat, What You Need to Know. That's the title of it. It helps to connect the dots between your hormones and also feeling more confident in your body. Let's keep learning, let's keep talking, and let's get louder and louder. Because the more we talk about it between ourselves, the more we feel open to talk about these things with our healthcare providers, the more they'll realise they need to get on board. And if they're not already informed about the menopause, they will get informed about the menopause, and just to support each other on our journey through this stage of our lives. Thank you for your time today. If you found it helpful, please give it a like. If you've got any questions, please drop them in the comments below, and I look forward to chatting with you next week.